Thank you so much for taking your time today. I really appreciate it.
Mm-hmm. Yeah, I mean, at its very core, obesity is a BMI greater than 30. But what I think, too, is that we're noticing it really also has to do with waist circumference and where fat is deposited on the body. Yeah, absolutely. So obesity in and of itself is, to me, more or less a symptom of an underlying condition or underlying health behaviors, right? It's not that obesity causes someone to eat unhealthy, right? It's the obesity is caused by that. So it is a symptom. What I think is that overall it can really impact our ability to go on with regular everyday living activities, right? Activities of daily life, like getting in and out of the car easily. It can put you at higher risk of developing heart disease, diabetes, renal disease, all of these really chronic issues that are definitely impacting our society more and more. Absolutely. Yeah, our way of living here in America is really not necessarily conducive to healthy living, right? We are kind of told to get up, go to work as soon as you possibly can, keep working all the way through lunch, come home, be as productive as possible even then, and then go to sleep. And I think just general self-care has kind of gone out the window, which is honestly really impacting everyone's health as we see with the rising obesity trends. Yes, I mean, especially with the availability of commercial food systems like fast food chains becoming all over the world. They are now international. With all of these changes to our food system, I can definitely see obesity trends rising in nearly every country. And if you include overweight in that category too, it's going to be definitely greater than even 60% of the whole population here on Earth. Absolutely. I think it's about prioritizing self-care again, right? And actually taking the time to pay attention to the food that we're eating. Maybe actually taking time to prepare our own food, which is kind of a novel idea, right? I mean, for the most part, even in college living situations, you might not even have access to a kitchen. So we're basically not learning any essential life skills. Home ec has been eliminated from school programs. No one knows how to cook anymore. And they think that it's complicated. It's reserved for like a specialty chef rather than just the everyday home person who can utilize the tools that really are available. And I think that's where it can start, is by learning those essential life skills. Exposing kids to actually participating in the food preparation process. As young as 3, a child can actually operate a butter knife. Wow. So, I mean, we can really start this early, but we're just not right now. Absolutely, yeah. There's a proven trend that those of the lower socioeconomic status likely participate in more unhealthful behaviors. I think too, though, that comes down to this idea that eating healthy is expensive and reserved for a special class, when in reality, you know, a bag of frozen broccoli really is just $1, right? But we get kind of caught up in this thought that it's too expensive to eat a certain way, and it also might come down to lack of formal education, right? There's some research to suggest that those with higher levels of education have more healthful behaviors as well, rather than those who maybe didn't complete high school. Absolutely. What I think is a really important distinction sometimes to recognize is that obesity in and of itself doesn't mean that somebody is unhealthy, right? There are actually plenty of examples of people who would technically qualify as obese, but resting heart rate is fantastic. They're very active, and they don't have any signs of hyperlipidemia or high cholesterol. Everything is looking good. It's not that obesity in and of itself means that they're not healthy, but those behaviors in the background, those are the things that are directly linked with chronic illness, right? So really I think it comes down to how can we help people behave in a more healthful way? How can we treat the body better to help prevent the chronic disease and the chronic illness that is really damaging our healthcare system, but also our society in general. I mean, it's expensive to have people with chronic illnesses, especially towards end of life time period. So we really do need to make this a top priority. I think really simple education about how do we make smarter choices, but not in this idea, the $1 billion diet industry wants it to be an overnight change, right? They say, well, Monday, start keto, or Monday, start this injection and come in every week. It's all about this like really drastic, over-the-top change, but guess what? That's designed to fail so that they make more money and you keep coming back for more. Dietitians, like myself, have a pretty bad business plan. We want to make sure you don't need us ever again. We want to teach you those skills on how to start small. So, for instance, we could make an incredible impact by having dietitians in, let's say, the grocery store, helping people make smarter choices with their purchasing habits, which is actually something that several grocery store chains are doing, but it's not as widespread as it could be. I think, too, maybe managing social media influence a bit and having a stronger focus on reputable, simple, easy start type of advice rather than being flooded with all of these fad diets or Instagram models and influencers who are trying to promote these unhealthy diet cycling behaviors. Social media is the number one influencer, right? So we need to find a way to, I don't want to say control it because I think then people instantly think I'm saying like shut down media and all this stuff. What I mean is I think we need to have a way of filtering out and not filtering out the negative things, but how can we overpower those negative images, those negative videos that are trying to basically scare you from eating anything? How can we overpower them? How can we put more reputable advice out there in front of the general public? And everyone's on their phones. I mean, we could find a way to get the message out there for sure. Especially if we can start it young. Like I said, a 3-year-old can start participating in meal preparation, right? Look too, we have this idea of like a kids meal at restaurants that serve really cool, awesome, different varieties of food, but there's a kids menu that just has chicken tenders and burgers on it and fries. Like we kind of are teaching kids so little that, nope, you eat fast food, you eat Happy Meals, you eat French fries and chicken nuggets, rather than here's how to actually prepare some broccoli, or here's how we can have fun in the kitchen again. In school, there's a cool program going on right now in a lot of schools, actually in northern Florida is where I experienced it, where they have school gardens. So kids in elementary school are participating in actually growing food that then the cafeteria uses. So then they're more likely to actually engage in that type of behavior and eating the actual food in that case. Something that simple has just completely changed that kid's outlook on food, right? So having really positive experiences with food from a young age, I think can also be really beneficial to our long-term goals as a country. Right. I mean, is there a genetic component to obesity? Yes. I mean, that has been proven that your genetic predisposition can give you a higher chance of some issues with weight. But at the end of the day, genes are just a part of the picture, right? It is the lifestyle, which you mentioned. I mean, I think there's sometimes a misconception that just by looking at someone, you can tell how active they are, or you can tell how healthy they are, right? I mean, we see it every day in our clinic, patients who have really struggled with weight. Let's say they're still in the 300-pound range, but guess what? 3 years ago, they were 500 pounds. And they've drastically changed their lifestyle. So I do think that we definitely have some issues with our lifestyle behavior changes. I mean, that's everyone, though. I've met plenty of people who would never qualify in the obese category, who are some of the laziest people I've met, right? Who don't want to move their body at all. I think that should be the overreaching theme, is let's move. I say it all the time to patients, but we were given legs for a reason. We were not meant to just Netflix and chill every single day out of the week. We were meant to move our bodies, and that's what we need to do in order to be healthier. Does that necessarily mean it automatically causes weight loss and now you'll be this fit person? Not necessarily, but can you improve your health in a million different ways by being more active? Yes, and that's what we should be pushing. Yeah, so that's such a tricky question, right? Because if we're targeting that specific population, you're really looking at social media. Mm-hmm. But if you look at social media now, it is bombarded with people who have no degree whatsoever in nutrition. They might not even have a degree in exercise science. They might not even be a certified personal trainer. They're just somebody who enjoys going to the gym and taking pictures, right? And promoting their idea of what healthy living is. And what works for them doesn't necessarily mean it works for everyone else. So I think in order for us to be successful targeting maybe like the teenage, like even 20-something-year-old population, something needs to happen where professionals in the industry become that trendy social media influencer. And that's what's lacking, right? We're not doing our job. And I'll be the first to admit it. I don't think dietitians are even doing enough to get ourselves out there to promoting the more reputable, evidence-based lifestyle approaches to that particular population, right? Doctors can definitely be doing it too. There are a few. Dr. Oz, I guess, is the most popular one, but is he still right now at this point only focusing on the reputable stuff? Who knows? But I think we need to find a way of encouraging professionals who work in the industry, who maybe work specifically with bariatrics even, to be the ones out there on the front lines trying to promote the image. Right? But maybe that means we have to partner actually with some of these social media influencers. Partner with them. We don't necessarily have to get rid of them. They don't have a bad intention. It's not like they're going on Instagram trying to cause body dysmorphia. That just happens to be a side effect. So could we partner with them, utilize their skills at getting out to the market, but providing it with evidence-based advice? So that might be one really cool way to do it. So we need to partner. And I know that's actually really not a popular opinion amongst others in my profession, especially dietitians. There's an opportunity right now. So technically the title is registered dietitian. But within our academy, we are now allowed to call ourselves registered dietitian nutritionists. That in and of itself has been so controversial in our field because a traditional title of nutritionist has no legal bearing to it. Anyone out in the world can call themselves a nutritionist. That's what most of these Instagram promoters will actually call themselves, as a nutritionist. So dietitians have really, on the other hand, been fighting against it, saying, no, I'm a dietitian instead. I am a RD, to try to separate ourselves from them. In my mind, we should take back the title. If we want to be the influencers, if we want to be the number one go-to for this type of advice, why wouldn't we steal that title back? Give it a legal binding definition. And that's when I think, too, if we're talking about partnering, like we can partner with these people, we can have our credential on that type of information, we can make it more easily accessible to everyday people. So it's just about getting out there, and we need to keep doing it. Absolutely. Yeah, it's crazy. But keeping in mind, too, that, this whole like idea of like the children, you know, the child's mind. I've seen it actually within myself. This is actually why I became a dietitian. So growing up, my parents were always incredibly like strict with our diet. They always said no sugary cereals. I didn't even know what Captain Crunch was growing up. Like Pop-Tarts, didn't even know that existed. Soda didn't exist to us. Like my parents kept us on a very tight ship in terms of nutrition. I think I was like one of the first kids to have ever tried the original Kashi cereal, which is really not great. But anyway, when I went away to college my first year, I was playing a sport with at the collegiate level. So in my mind, no parents around, I'm really active, I can eat anything I want, right? Which a lot of kids do. That's why that freshman 15 is so real. We go and we just eat anything we want because finally we don't have those constraints. What I see, and even with some of our adult patients that we'll have here, is the ones who didn't have that foundation as kids to eventually go back to, they're the ones who couldn't get away from just the freshman 15. Then it becomes the sophomore 20 and the junior, and then after college it becomes exponential. They continue to struggle with it because they didn't have the foundation. They didn't understand what it meant to go maybe back to, you know what? No, I need balance now. And that's what I think too. I mean, we can really make such an impact as with kids. Is it going to take longer for us to see the change as a society? Yeah, because we have to wait for them to grow up and figure it out. But long term, you know, that's our future. Have to have a strong foundation. Planning. I mean, seriously, that's like all we can do. I actually do have a family. I have a young daughter and another on the way. So I'm really busy and I do work full time, and I understand that struggle more than even just, you know, just a professional sitting here. Like I understand it because I'm living it, and planning is the only way to really get ahead of it, right? I actually say this all the time to patients. How much time are we wasting each day asking ourselves what's for lunch, what's for dinner, what's for breakfast? Every single day for an entire week, we are wasting all of our time, our precious time, just trying to scramble together a meal last minute. But then we're also more likely to say, I don't want to cook today because I don't want to have to even worry about it. Let's go out and grab something. But if we can take the time, 1 hour on a weekend or on any given time that you can set aside and actually plan through all of those meals, making a grocery shopping list from that plan, going to the store, grabbing the food, prepping what you can. I mean, it doesn't have to be this big elaborate thing that we see on Instagram as an example. It doesn't have to be that elaborate, but could we just help ourselves out a bit? Could we cut the vegetables ahead of time so that then on Tuesday night when you come home from a late work meeting, you can still throw together a meal in 15 minutes? And I think planning really is going to be that incredibly crucial piece. It's when we're not thinking ahead that we don't make the smart decisions, right? And then taking that a step further into exercise, planning for it. When you work full time, you are pretty confined to your schedule. But could you, for instance, in between patients, I'll sometimes do push-ups against my desk or squats sit squats against the wall. I mean, we can do these little things. I was an athlete all throughout my childhood and all through college. So when I first stopped playing sports, my idea of exercise was a coach screaming at me and I was sweating like crazy working out for an hour at a time, right? That's not realistic for me anymore. To have that type of environment where I can dedicate an hour and a half, 2 hours to going my hardest in the gym. That is not my reality anymore. So I had to create a new reality through careful planning. I had to figure out, what can I do? While my husband's putting our baby to sleep for the night, can I do a quick little 15-minute circuit in our living room? Those types of things, those little tiny behaviors really do add up to a healthy lifestyle. And that's what I want everyone to try to do, is just find what works for you and start small. In my ideal world, the trend would be slowing down. Which there was some data a couple years back to suggest that it actually was starting to slow down. It was still increasing, but at a slower rate. Ideally, let's see that reverse. let's see some of these chronic illnesses like heart disease. Type 2 diabetes is probably one of the fastest growing chronic illnesses in the United States. We're seeing it with kids as young as 8, I think was the youngest one diagnosed, with something we used to call adult onset diabetes.
Wow.
Right? So this is a real issue. I hope to see it reducing. I hope to see this wave of influence coming through that is promoting just a general healthy diet, right? The diet industry is going to be here forever. I mean, it's been around for centuries. For as long as people have been there, here on Earth, we've been trying to diet with these quick fixes. But I do hope that some of these become a thing of the past pretty soon, because it's creating this weird behavior where we diet and then we binge, and then we diet and then we binge. And that's really contributory to obesity rates as well. So I hope to see it go the other direction. I hope to see people promoting these small, simple changes that can reverse these chronic illnesses. I hope to see physicians promoting small, simple changes in a totally realistic way and in a helpful way to their patients early on, rather than at the time of diagnosis. Why don't we try to tackle it when we start to notice that an issue is there? That's where I really hope to see just our healthcare system in general. I want to see us being more proactive rather than reactive. I think that trend is happening. I think it's starting, maybe it's just murmurs right now, but hopefully it becomes the norm, right? Of every healthcare practitioner trying to get ahead of this while we still can. 2 things, actually. Sin taxes on things like sugar-sweetened beverages, which some states have actually already started. I believe it's Colorado and California. No different than cigarettes and alcohol. Things that we know we're trying to reduce total consumption of in our country have a higher tax mark on them. Okay. So taxing some of these food items might help deter the purchasing, like we have seen with reduced cigarette smoking and reduced alcohol consumption through these types of programs. The other thing is, I think it would be fantastic to have restrictions on how many fast food chains can be in a certain location, meaning like for every 3 miles or something, have a restriction on how many can be there. That would be phenomenal because we see it all the time in areas that we would deem food deserts. They don't have a grocery store for miles, but there will be 10 fast food chains all stacked up together. What can we do to help improve this? What can we do? And I think by creating some guidelines there, like city guidelines on how many. I grew up in Ponte Vedra Beach, Florida. The city themselves had a restriction that only one fast food chain could be in the entire city. Only one. And I think McDonald's had to fight tooth and nail to even be that one. I mean, it was pretty wild. So there are some areas who have decided to do this, to actually block fast food chains from even being an option. Now that's not realistic across the board, but can we at least have guidelines in terms of distance between? That type of thing to help just improve the availability of other types of food. But I do think that would be incredibly helpful, right? Is to have just certain restrictions around these foods that, I'm sorry, no one could ever try to argue with any professional that sugar-sweetened beverages are a health food, right? I mean, that's just not going to happen. Go ahead and try, but it's not going to happen. It's no different than, to me, cigarettes. I mean, if we can have such a powerful initiative to reduce cigarette smoking in the country, why can't we have that same type of gusto trying to reduce the amount of soda consumed? That would be huge. I mean, food deserts are a real thing too that I do think need to be tackled. I don't know if there's a really simple solution to that, though, right? Because you can't mandate that there is a grocery store for every square feet. That's dependent on the company going in, right? Yeah, you can probably control what goes in, but like we can control fast food places going into locations, but we can't just say, no, sorry, you have to build a business here. So how can we get these food deserts access to healthy food? when all that's close to them, and I've heard it from so many patients, the only thing closest to them is a food mart inside of a gas station. Mm-hmm. Some gas stations are actually really trying, and they do have some gas stations up north actually have dietitians who work with their team that have like fresh fruit offerings available in the store. They're trying to improve the health market there, but that's really slow. It's not moving near fast enough. So what can we do? I don't know what the solution is to it, but that would be amazing if someone could figure that out. There's so many barriers in the way, right? That can feel so insurmountable, but I do think if we can get enough professionals, especially young professionals new to the field, those who are most eager and most willing to be out there on the front lines, if we can get all of us together and just band together and really push forward for this type of effort, we really can make that dream a reality. But we have to actually come together. We have to be okay partnering with everyone.